so thank you so much, Allison. So once we get started, your handouts and PowerPoint is also going to be available in the chat box for you as well. And then at the end of our survey today, or pardon me, at the end of our presentation today, we're going to have a survey at the end. And we would ask that everybody just takes a couple moments to fill it out and offer some feedback. Hi, Tanya, welcome. All right, so we're gonna go ahead and get started. I do have just a disclaimer that I'd like to share today with everyone. This training is offered through the Crisis and Recovery Enhancement TA Center, which is funded by the California Department of Healthcare Services and administered by the Center for Applied Research Solutions. The views, opinions, and content expressed in the presentation do not necessarily reflect those of our funder. In the case of any security issues that may occur, this session will immediately end and will not resume. A separate email will get sent out to you, to all participants, with further instructions. Thank you so much. And so just a little bit of need to knows for our community agreements. As I mentioned, you are welcome to use the chat box to message the speakers. If applicable, you may send messages that are viewable to the whole meeting room as well. We do want to ask you to please use I statements in the chat and to avoid making comments that are stigmatizing or otherwise injurious towards others. If you do not want to engage in the chat feature, you also can minimize that chat box as well. You can also select speaker view to enlarge the video of the speaker and remove most participant videos from your view. If you do experience any type of technical challenges, we do have a CVent Tech host, Allison, here today, Allison is available to support, and you can message the CVent host in the chat box. Thank you, Allison. So just some community agreements to share. Please be kind and courteous, listen attentively and with an open mind, share the space with others, accept a lack of closure. We won't get into everything today, but we're going to get into as much as we can as possible. Also, if informed that our comment or behavior is stigmatizing or injurious, we will acknowledge and we will also apologize. We do have some crisis resource lines there on the screen for you as well. The National Suicide Crisis Line, the Crisis Text Line, NAMI Helpline, and the LGBT National Hotline. Take a moment to jot those down. Thank you so much. Today we are joined with Dr. Beverly Muhammad, and I just wanted to share a little bit about Dr. Muhammad is a CEO of Corporate Executive Consulting, LLC, and has spent her life committed to racial unity and social justice. She was the co-founder of the Institute for the Healing of Racism in Broward County, Fort Lauderdale, Florida in the early 80s, and the first diversity leader for American Express, whose infrastructure continues today. She works with organizations to help build unique platforms to transform their organizational DNA to one where there is a culture of diversity and equity and inclusion. Dr. Muhammad is a strategist, a technologist, consultant, coach, educator, and author of various articles and diversity and research expert. She uses her eclectic background to advance organizations in their creation of strategies to address diversity, equity, and inclusion, inspire leaders to be the best they can be in the achievement of their goals, and she guides leaders through effective research to help solve organizational problems. Dr. Muhammad has several recognition awards, and one recent award she is especially proud of was awarded by the Arizona Black Board of Directors because of her lifelong work committed to working to build great communities, titled to Dr. Laura Banks Reed Living Legends Award. Dr. Muhammad earned her Doctor of Management degree from University of Phoenix. And I'd like to pass the floor to Dr. Beverly Muhammad. Thank you so much.
Thank you, Tori. Greetings and welcome, everyone. I'm delighted to be invited here. I want to first share my sincere appreciation not only to Tori, but to the Crisis and Recovery Enhancement TA Center for inviting me to present my perspectives. I hope that after this presentation, you'll be able to recall historic works of past presidents who attempted to create what we call public sentiment, understand life expectancy disparities according to various entities, recognize insidious, or some may say implicit biases, disparities, behaviors that create healthcare disparities, and then learn the steps that one company is taking to bridge the gaps of disparity with their internal work, creating an environment where diversity, equity, and inclusion is paramount. So I wanted to start by laying the foundation and a clear understanding of what I mean by public sentiment. Public sentiment is a term that each of us may understand differently. So I want to share two definitions defined by the Merriam-Webster Dictionary and the Cambridge English Dictionary to ensure we understand the context of my discussion. And I want to share this because we will recall some historic works of past presidents who attempted to change public sentiment to bridge gaps of disparity of institutional and structural racism. So, according to the Merriam-Webster Dictionary, sentiment is defined as an attitude, a thought, or a judgment colored or promoted by feeling or emotion. Now, the Cambridge English Dictionary has the following definition of sentiment: a thought, an opinion, an idea based on a feeling about a situation or way of thinking about something. So I wanted to share these because although they're similar, some of the words are different. Keeping those definitions in mind, I want us to recall the history of two past presidents who attempted to create public sentiment and conclusions cited by the Kerner Commission. In 1858, Abraham Lincoln attempted to create public sentiment. In fact, he debated with Stephen Douglas concerning slavery by saying, "In this and like communities, public sentiment is everything. With public sentiment, nothing can fail. Without it, nothing can succeed." In 1967, President Lyndon Baines Johnson formed the National Advisory Commission on Civil Disorder to address the root causes of riots that erupted in 150 cities. When the Kerner Commission issued their report, they cited institutional racism, police brutality, and a lack of employment as the reasons for the riots. Sound familiar? Fast forwarding to 2016, 49 years later, the Kerner Commission reported the same. Institutionalized racism, police brutality, along with a myriad of inequities and opportunities for health, housing, education, transportation, and most social determinants of well-being still persist today. However, I don't want us to despair because there is hope. Today, I just want to narrow our focus to the disparity of healthcare and life expectancy. But before doing that, I want to review the term racism and its definition, because I think through this definition, you'll clearly understand the context of my discussion. The past president of American Public Health Association defined racism as a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what we call race, that unfairly disadvantages some individuals and communities and unfairly advantages other individuals and communities, and it saps the strength of the whole society through the waste of human resources. I found this definition appropriate for our discussion today, so let's pause just a moment. We reviewed the definitions of public sentiment from 2 dictionaries, Merriam-Webster and the Cambridge. We recalled the historic works of 2 past presidents in their attempts to create public sentiment, and found through the summarization of the Kerner Commission that not much had changed. Now I want to illustrate using life expectancy disparity as an example. I want to share a definition first of social determinants as defined by the World Health Organization. They state the condition in which people are born, grow, work, live, and age, and the wider set of forces and systems shapes the conditions of daily life. These forces and systems include economic policies and systems, developmental agendas, social norms, social policies, and political systems. Now they define these as non-medical factors that influence health outcomes. Some examples as defined by WHO, the World Health Organization, are elements that can influence health in positive and negative ways. Income, social protection, education, unemployment, job insecurity, working life conditions, food insecurity, housing, basic amenities, and the environment, early childhood development, social inclusion, and discrimination, structural conflict and access to affordable health services of decent quality. Knowing these as social determinants and individuals' well-being, take a look at how life expectancy is shown by some of these elements mentioned here. During my research, I questioned what is the most devastating impact of the disparity of healthcare to marginalized individuals. And of course, the answer was life expectancy. I found this diagram depicted by the American Public Association and provided by Robert Wood Johnson's foundation. Take a look at the examples provided here of a Washington, D.C. area. In one area, note noted as 17 miles away, there is a disparity, a 3-year lifespan disparity. In a 30-mile distance, there's a 9-year lifespan disparity. Taking the question from the American Public Health Association and paraphrasing it, I'll ask you, why is it that where you reside can have an adverse impact on your health? We're going to take a poll, and I'd like for you to select your response from the poll, and let's see how each of us answers. So we're going to give you time to respond to these. One is the environment may be responsible, community sentiment may be responsible, institutionalized or institutional racism may be responsible, or all of the above. So we're going to give you time to respond to that. Okay, I think we've given ample time. Can we see our results? Okay, this is pleasant to see. 99% of you said all of the above, and there were a few of you that said the environment, the community, and institutional racism. All of you are correct, and you're absolutely right. Things such as your environment, your community sentiment, institutionalized racism, all have to do with life expectancy. But there are several others as well. So what might those be? Here's another diagram provided by the American Public Association. Did you know that your income can impact your life expectancy by 10 years, education by 9 years, and your race by 7 years? Sadly, these three certainly impacted my family, and particularly my mother. My mother was diabetic. She had no idea because she was not engaged in a healthcare plan and was never treated until much too late. Her diabetes led to cancer, and she died at an early age of 68. Now, some of you may think that's old, but today that's young. I guess my point here is our diets were not always healthy, and we had access to a convenience store, but the food there was carbohydrates and sweets, of course, sugars, and little to no vegetables and fruits. And of course, exercise for my mom was pretty much non-existent except for annual trips to the home and garden show from babysitting money she saved for this particular annual event. I share this with you because for me, life expectancy disparities is a very critically important issue. And if we can make a difference, whatever the size, let's do it. I want to just provide a few examples of what I've defined as insidious, and some may say implicit bias behavior, in which behavior in healthcare that can continue the perpetual statistics of life expectancy disparities. So here are some very simple examples that might include very simple insidious behaviors that create healthcare disparities. For example, failure to identify hidden social challenges of minority and marginalized individuals. Failing to ask stress-related questions may lead to a misdiagnosis. Another insidious behavior is prescribing medication a patient can't afford or suggesting patient behavior modifications when there may be other issues at play. So, what are some solutions? Some solutions might include asking questions associated with stress or including the questions on a questionnaire, prescribing medications patients can afford or offering samples for assistance, creating more supportive environments, offering community-free resources, developing supportive relationships. Examples might include free help groups. I'm working particularly with a company who's addressing all of these things and more. And they're doing it concurrently because they realize in order to create public sentiment and to change some of these disparities, they needed to begin with their most valued asset, their employees. So I want to move and share with you, if you please, some practical steps one company is taking to bridge the gaps of disparity with their diversity, equity, and inclusion focus. And for me, in the years of my work, I consider this company that I'm working with to have some of the best practices. I'm privileged and I have the honor of working with an international mental health organization that realized that after witnessing George Floyd's tragic death, many things needed to change within this company. Their focus had always been to change public sentiment, help those who needed recovery, and promote positive and long-term lifestyle changes using their unique approach. Missing was changing those who served their patients. They began by taking practical steps to help bridge the gap in healthcare disparity by having their leaders commit to creating an environment where the diversity, equity, and inclusion would be embodied in the DNA of the organization. They initiated several practical steps. The president of the company, very, very passionate about diversity and inclusion. And for those of you here who may be with healthcare organizations or may work for organizations who have diversity initiatives ongoing, or those that are looking to create their diversity efforts within their company, one key element is you must have a passionate, supportive leader. This leader of the company that I've had the privilege of working with identified leaders across all the regions of the organization. So they're not only national, but they're international as well. That leader formed a diversity, equity, and inclusion council, hired me to develop a diversity, equity, and inclusion roadmap or framework. And so with that framework, I was able to collaborate with the Diversity, Equity, and Inclusion Council, and we established 7 key areas of focus. One was cultural assessment. The second was education, Third was measurement. Accountability was fourth. Networks were fifth. Communication was sixth. And then we created what we call the implementation area of focus. So I want to just stop a moment and talk a little bit about those key areas, because I want you to understand how important it is to integrate diversity, equity, inclusion into the framework of your organization if you're looking for sustainable results. Now, keep in mind as I talk about these council members are volunteers, along with the other individuals that I'll talk about. They are volunteers as well. The cultural assessment group was comprised because this company wanted to understand what is our diversity, equity, and inclusion culture. What is it like? So they took a look at very distinct areas. What are we doing out at the regional levels of all of the organization? Are we administering surveys to our clients? Are we keeping track of their demographic information, meaning ethnicity, gender, age, those types of things? Where are we with our talent acquisitions, our onboarding? How are we doing with our people that are disabled? How well are we accommodating their needs? All of those things were considered. Now, this council was stood up back in July, and so they're fastly approaching 1 year, and the work that they're doing is just phenomenal. Well, this cultural assessment is a benchmark. It's going to be the work that they're doing there, and reporting will be what they use going forward each year to see how well they progress. They also have an educational area of focus. That area of focus, they have created, they have selected education. They have a strategic plan for the full year for how they're going to roll out education to their employee base. And they also have a plan for partnering across all the areas of focus to ensure that they integrate education in every aspect of the work that they're doing. The measurement team that I mentioned previously is just that. This team's focused on key performance indicators. As with everything, whatever work you do, you must measure. How will you know how well you're doing if there are no key metrics in order to determine where you are and what you're doing? So that group is doing that series of work. There's an accountability team who also has a strategic voice, and they are taking a look at the accountability throughout the organization. Now, they're not human resources, so they're not actually addressing every issue, but they literally are partnering with HR just to ensure that they stay in line with what HR is expecting for them to do, but they are partnering and collaborating with them. The networking group is an interesting group that they're standing up currently, and this networking group is opening up to the company the opportunities for employees to stand up what we call networks or affinity groups. I think some of you may be familiar with networking groups. There are Black employee network groups, there are LGBTQIA groups, there are Christian groups, there are different types of networking groups, and those groups are critically important for an organization because those groups are the impetus that give the company their cultural environment. Not only do they do that, they provide a very safe place for employees to share best practices, to talk about things that are conducive to their group, and to help build their self-actualization needs. Finally, there's a communication area of a focus. That area has a YouTube site. They publish a newsletter regularly, and they engage in what they call monthly conversations. Those conversations are rich, they're educational for the employees, and they're actually making a difference. After each one of those conversations, the console measures how well they're doing using a survey. And interesting and wonderfully reported is that throughout each one of the dimensions that they measure, they're showing positive results. Employees are able to share what they want to see upcoming, and they're also able to share anonymously how they feel about the sessions that have been conducted. Some of the topics have included Black History Month, COVID-19, so they vary, Asian American, Pacific Islanders, and some of the challenges that they faced, LGBTQIA, numerous topics, all of which employees are finding enriching. They break out, and these are all virtual meetings, much like this one, where they're able to break out into break rooms and have discussions, and some are panel discussions where they pose questions. I share this with you because this company is doing what I believe to be the right things to do with diversity, equity, and inclusion. And in all my work of working with different organizations, they exemplify what I believe to be best practices. They have sought additional support by defining the roles of a cultural champion and support squad members, which mean these are individuals that are not necessarily at the headquarters, but they're dispersed throughout the organization that are serving on each one of these pillars, with the council being executive sponsors across each pillar, removing obstacles and allowing these employees to reach their full potential. So they're galvanized by collaborative efforts that they're using across each one of the pillars. Now, as with everything, nothing's perfect. So what have we learned? What we have learned is that when you establish a team, it's very, very important that very early in the process you conduct team building, because some of you may be familiar with forming, storming, norming, and performing. And we all know, whether it's with our spouse, whether it's with our friends, whether it's with our church members, regardless of who it's with, when you form to perform any activities or just engage, you go through those phases, and having team building and being able to galvanize and openly discuss those things are critically important. So one of the lessons we learned was that we dove in very deeply into addressing diversity, equity, inclusion very quickly, and didn't quite do the team building. So in retrospect, in the future, we will do those things ongoing so that that cohesiveness remains. Additional to that, we conducted our cultural assessment benchmark study, but in some cases we needed additional metrics. So we're going back to gather those additional metrics in order to enhance the true nature of where this company stood in 2020 and throughout 2021 to give them the benchmark of where they need to move forward. So I wanted to just share that with you because it's been such a privilege and it's been such an honor to be able to work with this group. If you're interested in forming or enhancing your diversity and equity and inclusion work, you can feel free to email me, and my email address is in the back of the presentation. But I hope that through this presentation today, you gleaned just a better understanding of public sentiment and how it affects others, the importance of life expectancy, and how our insidious behaviors or implicit bias behaviors may impact others, and how you might change yourself, your employees, and or your family by expecting something better and engaging in the diversity and inclusion of all those that you encounter. So now I want to open us for questions and or comments.
Thank you so much. Hi, thank you so much, Dr. Mohammed. So I just wanted to let you know we have some real positive feedback in the chat room. And also some participants asking if they can get a copy of your wonderful PowerPoint as well. And I do see that one question came through. Melissa mentioned that it is interesting, and Melissa is glad that you're including LGBTQ groups, Pacific Islanders, and African Americans. But there is a rise in violence against Asian Americans, and it is sad to me that we haven't included them yet today. Did you have a response for that?
I do. You know, and that's a very, very good question. I'm glad she raised that question. We just recently invited a gentleman. His name is Frank Zhu. And Frank came in and he really gave a wonderful presentation about Asian Americans and Pacific Islanders and the importance of insisting that they be treated fairly. In his presentation, he had these videos depicting the just unpleasant and mean things that individuals are doing to them as a result of, for whatever reason. I would assume, which is something I don't normally do, but a lot of it was directed towards COVID-19. And they were unfounded, they were unpleasant, and they should have never taken place. So I'm in total agreement with you. And the company that I'm working with found that this was such an appropriate topic that if you have an opportunity and you see my email, by all means, send me an email and I will forward you Mr. Frank Zhu's email address so that he can come and speak to your organization or conduct a presentation as well. So great question, Tori. Thanks for asking.
Thank you, Dr. Mohammed, and thank you, Melissa, for your question. So I haven't seen any additional questions. I do have some wonderful comments. Tracy said, thank you. I love hearing from well-educated and topic knowledgeable presenters. And Jennifer said, great presentation today. Thank you.
Right. Well, go ahead, Tori.
I have another question that came in from Ebony. What are some strategies to elicit cultural champions?
Oh, great question. One of the things that, and I'm not sure in what context you're talking about cultural champions, but certainly my experience has been if you're working for a company and you're looking for cultural champions, first and foremost, define what you want to call a cultural champion. Also, define how and what that role will entail. With the company I've had the privilege of working with, they define the role as being able to change the culture and align with the Diversity, Equity, and Inclusion Council's mission. And they also outline the minimum hours per month that the cultural champions would volunteer to do the work to help change the culture in the organization. And amazingly, they've had numerous employees step up and say, I want to serve. In addition to that, you'll find that as they serve and come into their full potential, and I say this to say, oftentimes employees go about their day-to-day work and they're just performing their jobs, and then when they get in align with the council, they begin to pursue their passion. Oh, I don't want to be on the measurement team, but I'm very good with education because it's something I provide for my church or for the organization. And my goodness, watching the growth, watching them flourish is amazing. And then when others see that, it becomes infectious. They say, oh my gosh, look at Susie or look at Joe. He just stood up this wonderful video and he put up this production together. Oh my God, I do this for my community work. I'd love to be a part of it. So it becomes it becomes infectious. And hopefully I answered your question.
Thank you so much. Let's see here. I'm going to take a look and see. It looks like Ebony had a, Ebony says, yes, you did. Thank you.
You're welcome, Ebony. My pleasure.
Okay, so I'm not seeing any additional questions. If anyone has any questions, please feel free to message them in the chat room and we'll be sure to get them over to Dr. Muhammad.
So, Tori, I am interested if you guys would just talk about in what ways might you help reduce healthcare disparities. Can we get a couple of comments in the chat room to just share with Tori and myself what you might do? I know that everybody's not in healthcare, so you might work for or a company that might be a business organization, or you might have an ailing parent. You may be a healthcare professional, but how might you reduce healthcare disparities?
So while everyone's kind of thinking about how they would reduce healthcare disparities and putting those responses in the chat, it's been brought to my attention, thank you, Robin, that Ebony had a part 2 question. So Ebony mentioned that I see you hired a DEI consultant. Is it recommended that you start with an external consultant or hire a role within your organization that leads initiatives?
Oftentimes, of course, they hired me, so I don't want to be biased, but I caution companies initially by selecting someone inside, because oftentimes you can't see the forest for the trees. And in this instance, the president and CEO of the company decided to have an external person do the work so that there was clearly a way of looking at things just a little bit different. Now, later, it's wonderful to transition everything inward, but using an external individual is best because there's always resistance. And that resistance, that outside consultant can address the resistance, whereas someone internally may not be able to do that quite as well without getting caught up in the political chaos, for lack of better words. Hopefully I answered your question, Ebony. Was that Ebony, Tori?
It was.
Thanks, Ebony. Love your questions. Keep them coming.
So we have a response from Jennifer. I have a domestic violence initiative. Our organization provides quality service to everyone, regardless of race, creed, color, or socioeconomic status. Thank you, Jennifer.
Great, Jennifer. And that's the way Jennifer is going to help reduce healthcare disparities, because they're not looking at those differences. They're looking to help everyone. Wonderful, Jennifer.
Alrighty, so let's see here. So Ebony states that we look at the data. What are the outcomes for our BIPOC, pardon me, can't talk right today, BIPOC, LGBTQ, and other marginalized communities? When we look at the disparities and disproportionately to address barriers to engagement, access, and etc.
Okay, was that a question for me?
Yes, so the question are, what are the outcomes for our BIPOC and LGBTQ and other marginalized communities? And actually, she says this is more of a response. Thank you, Ebony.
Okay. I was going to say, I'm not quite sure. But great comment, Ebony. Thank you. So Tori, that's probably all the questions, huh?
That's all the questions I'm seeing so far. If anyone has any ideas of how you can reduce healthcare disparities, please feel free to put those in the chat so we can share with everybody. We have an individual with Merced County that says, have a conversation with leadership and be intentional, listen to our stakeholders and our community voices.
Very good. Very good. I could not have said that better. Absolutely. Very good. Any other questions?
I'm not seeing any additional questions at this time.
Okay.
Just some responses that they love listening to stakeholders, very important. And Violetta mentioned it's important to address implicit bias.
Very good. And I think, and hopefully everyone understands what they mean by implicit biases. Implicit biases are attitudes or stereotypes that affect our understanding and our actions and decisions in a very unconscious manner. And so that's critically important to give thought to. Because oftentimes we're not sure that we're being biased until someone either brings it to our attention or we take ourselves into account, which is something I tend to do each night, and ask myself, in what ways have I hurt anyone, and in what ways can I make amends, and in what ways can I be better tomorrow than I was today? And so oftentimes we're not even conscious of our stereotypes until much later. And that's called the implicit bias. And we all have it. Thank you. Good comment.
Robin says another way to reduce healthcare disparity is to promote understanding and conversation within a faith-based organization and encourage public discourse.
Oh, perfect. Robin, I'm not sure, Robin, that's an excellent comment. In fact, every Friday I meet with a group of individuals, which is faith based, and we engage in conversations centered around racial unity. And these groups, you can't heal until you realize where the disease is, for lack of better words. And so in these groups, we literally engage in open, frank, and honest communication. And I mean, some of the conversations can be painful, but there's so much needed, and it's a way for everyone to heal. And these are safe places to gather, much like the networks that I discussed previously in the presentation. Great comment, Robin. Thank you very much.
Violetta had commented to one of your statements a little bit ago and said it's hard to know what you don't know, which is why the ability to take in feedback is so important.
Oh, very good. In fact, this company that I'm interacting with, that is one of the purposes that they have these monthly conversations, because many of the employees said, I don't know what I don't know. So if I'm offending someone, how do I correct that if I don't know I'm offending someone? And so these monthly sessions, they're an hour and 15 minutes long, but they are just so meaningful. And I'm just watching the growth of the individuals and the richness of the dialogue, and it's so wonderful to see.
So for the last session in our statement and our question and answer session for today, we had a comment coming out of Merced County: honor inclusion and diversity, ongoing individual assessment, find out what our messages are about others.
Oh, very good. Very good. No need to even elaborate. That was pretty clear, pretty concise, and well said. So, very good. Okay, Tori, I think are those all the comments?
Yes, it looks like we got all the questions and answers for today.
Tori, there was a comment and they asked if I would send my PowerPoint presentation out to everyone. Absolutely. I will send that to your email. And in addition to that, anyone that would like to reach me, this is my contact information. When you get the PowerPoint, feel free to reach out to me. I will get back to you as quickly as possible. I thank you, thank you, thank you. I'm humbled and I'm pleased to have presented today on behalf of CARE and the TA Center. And Tori, I can't say enough about your support, being my moderator today. Excellent job. And thank you. Thank you, everyone.
My honor. And thank you everyone for attending and being here with us today. we really want to hear from you so we can keep bringing all the resources and all of our speakers and continue in these conversations. We have put the feedback form, Allison dropped the feedback form link into the chat with everyone. It says https://cvent.me. Please take a moment to click that link, open it up, and provide us some feedback. And we're going to use it to plan our future learning opportunities. So again, it's so nice having all of you guys here today. If you have any questions, please reach out to our care project coordinator, Ruth Santos. And again, thank you. We just appreciate having you, and we hope to see you in the rest of the conference today.
Thank you, everyone. Bye.
Thank you so very, very much, Allison, for being our support as well and handling things on the back.